Are you searching for purpose of life? Discover your true identity. Stay tuned to Shalom World.
Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association explore topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today we explore a topic that's uncomfortable and frightening for many: cancer. When I was growing up, I heard adults talk about cancer in hushed tones, and I didn't speak about it unless spoken to first, which was rarely. And I didn't know what to say. Heck, I didn't know how to talk about cancer when I got to medical school. Receiving a diagnosis of cancer is a life-altering event that will affect 2 out of every 5 people at some point in their lives. And it's a subject that can be difficult to discuss, even though the rate of cancer deaths have been decreasing a little less than 2% per year for the last 20 years. It's the number 2 cause of death in the United States, causing almost 1 in 5 deaths. And worldwide, there are over 18 million new cases of cancer and more than 9 million cancer deaths every year. Compared to women, men are 40% more likely to die from cancer, which means that about 1 out of every 2 men and 1 out of every 3 women will develop cancer. Among various ethnic groups, Black men have the highest incidence of cancer, while Asian and Pacific Islander women have the lowest rate. The good news is that there are simple steps you can take to reduce your risk of multiple cancers, and it has become easier to both diagnose cancer and treat it with ever more effective medications that have less serious side effects. Joining us today is Dr. Felix Rodriguez, a medical oncologist who has practiced for 20 years in and near Boynton Beach, Florida. He'll help make some of the mystery of cancer more understandable to us. Felix, welcome to Vital Signs.
Thank you for inviting me to this show from the Catholic Medical Association and Shalom TV.
So, Felix, what is it that made you decide to become an oncologist and treat patients with cancer?
Well, cancer care is very challenging, and as we have seen over the past few years with all the molecular technology, what attracted me to it originally was the intellectual part, the scientific part, all of these nuances of cell physiology. But as a physician, my vocation as a physician, I really wanted to help people. And with cancer care, you definitely get a sense that you're making a difference in people's lives. So that was my sense of wanting to get this specialty. The other thing is this is a specialty that involves a lot of interaction with other colleagues, and it's very fulfilling to do that.
So, Felix, I love the way that it transformed from something, intellectual to something relational. So what is it like in that relationship to give a patient the diagnosis of cancer?
Well, so one of the things that I try to do when I meet a new patient, and for instance, today I had a lady with a new diagnosis of cancer, I have to understand and recognize that patients are going to be very anxious visiting me. Sometimes they will tell that. And so I have to, from the moment I open that door into the exam room, I have to be very careful and very empathetic as far as the fact that they know that they have a cancer most of the time when they see me, but that I need to put on my mercy lenses, if you will. It does take some time to get prepared. I want to make sure that I get my chart ready and that I've studied the case to some extent before I sit down with them, so that I can impart on them a sense of calmness and understanding.
After they've received the diagnosis, after they've met you, what are the most common initial questions that patients have right after they're diagnosed with cancer?
A very common question is, am I going to be all right? Am I going to be okay? especially if this is something that is what we call the adjuvant therapy, when people have had their cancer extracted and they just need chemotherapy so that the cancer doesn't come back. But for instance, when we get patients that have stage 4 disease, metastatic disease, they want to know, am I going to die soon? What is going to happen? So those would be the two most common questions. But if I could frame it as, am I going to be all right? That would be the most common.
It's really challenging when these patients, until recently, were living in what they would consider the land of the well, the land of the healthy. How do you help them traverse the chasm from the land of the healthy to the land of the sick?
So I try to assess that they have the right support system. Sometimes, many times, they do not. As I said at the outset, I try to make sure that I explain what is going on in precise terms that at least they can understand. I tend to repeat a lot of the questions and a lot of the statements that I'm making because I think as long as they understand what's going on, even if they have little knowledge of medicine, at least they can have a handle on it. Cancer is a condition that takes away your control. But if they feel that they can control some extent of their process, then that will make them a better ally for me as a physician.
That's pretty wise to give them something that they can control. And you mentioned they ask, am I going to die? A common question, at least in the movies that we see, is, Doc, how long do I have to live? How accurate of an answer can you really give, Felix?
Most of the time, I cannot give an accurate answer. Only when it's evident that they're extremely ill, but that happens when they're in the hospital. Typically, when they come to see me in the office, they are not really that sick. Sometimes they are, but most of the time, even with stage 4 disease, I have to pretty much assess how extensive the cancer is. There is a measurement that we use, very subjective, called performance status. So if they're in fairly good state of health, it's very difficult to predict. But I tell them that it is a process of time. And especially if I'm going to be introducing any anti-cancer therapy, I want to convey to them that we're going to try our best to make sure that they live the most that they could live with the condition, and particularly that the symptoms are going to go away. So as you can gather, these discussions tend to take a lot of time. But once again, as long as I can make them understand the process, I think this whole stress of how long do I have to live gets transformed in how do I fight the cancer.
Well, that's very good, focusing on what can I do instead of how long do I have. So, Felix,
Mhm.
you've been around the block a few times with cancer, over 20 years worth. What are the biggest changes in oncology you've seen since you started treating cancer patients?
Well, there are new technologies and new therapies that are out there that we are now using more commonly. One of the things, if I go before the technologies for treatment, technologies for evaluating cancer, when I was in training during the 1990s, PET scans were not available. They were not around. Actually, I remember I'm in Boynton Beach, which is very far away from University of Florida in Gainesville. The very first time that I sent somebody for a PET scan, I had to send them to an academic center, University of Florida. Now we have PET scanners all over the place. So as far as the diagnosis of cancer and the imaging studies, also the pathology, and we are now using a lot of molecular studies to try to determine what kind of therapy to use. So the biology and the understanding of cancer is much nuanced and much more precise. We're using the term, it's like you can individualize the cancer. And that to me is very exciting. I know that I will be seeing that even get more nuance, to keep using that word, over the next few years.
So, has the chance of dying from cancer improved over the last 20 years? We can find it better. Are people living longer?
Indeed, they are. Indeed, they are. Because of these therapies. And I want to use the example of immunotherapy, which is one of the latest technologies in cancer care. an immunotherapy that is not chemotherapy. It is a way of stimulating the body's immune system to fight cancer. And so these therapies are, in many cases, miraculous. Doesn't work for every patient, but when you see patients that get such quick responses to the immunotherapy, it's something that gives you a lot of hope for the future, and also the length of time that they will be living.
And is it easier to treat patients now? I remember back when I was in school, almost all of the therapies had horrific side effects that patients dreaded. How is that better now?
It is much easier. Even during my training years, I was part of at the University of Connecticut where I trained. We were part of the clinical trials on the drug ondansetron, which back then was only intravenous. And we treated patients with severe side effects from chemotherapy, nausea, vomiting. Most of the chemotherapy was actually given in the hospital, not in the clinic. The clinic was just to evaluate them and come up with a treatment plan, but the chemotherapy was in-house. That quickly transformed with the anti-nausea medications, with the medications to raise the blood counts. And so now most of our therapy is indeed in the office. And when patients get admitted to the hospital, it's for other things related to the cancer, not necessarily to the therapy. So to answer your question, yes, it is much easier. It doesn't mean that patients don't get side effects, but there are side effects that are managed in the outpatient basis.
So, what are the main changes in those side effects that you mentioned? And plus, it sounds like they'll be having the side effects at home with family instead of away from family in the hospital.
I mentioned the example of nausea. The anti-nausea medications that we can give as prescription, we just send them home with them. We prescribe them to the drugstore. They can use that at home. The other things, the growth factors, there are these chemicals that have been around since the 90s, actually. We can give them an injection, and we know that if they've been on chemotherapy, their white count is not going to drop to dangerous levels. And as you well stressed, patients end up being home with their family rather than having to go into the hospital and be most of the time alone or what have you. So that has improved tremendously, and it makes people tolerate the whole process better. Not just the side effects, but the fact that they can be with their family members and their loved ones.
Thanks be to God. Felix, for you, what is most fulfilling about treating patients with cancer?
When I can make a difference in their lives, this is either when they can, if they have stage 4 disease, when I can make sure that I treat their symptoms that are being caused by the stage 4 disease, or when I can treat them and then give them the good news that the cancer has gone. Those are moments that I always treasure. And the other thing, and I know this is a Catholic network, there are patients with whom I can share a little bit of Catholic spirituality or otherwise. And there are patients that sometimes open up to that dimension, and I can share, sometimes even prayer with them. There are several of my patients that, even when they're from a different faith, have asked me for prayer. And so I know through that I am indeed making a small difference into what they're going through.
Do you have a favorite story from one of those patient interactions, Felix?
Yes, there is one particular patient who's been my patient now for about maybe 6 years. Every visit, and I see him every month, when he realized that I was Catholic, he brought me a rosary. And then every visit, we start with an Our Father, a Hail Mary, and a Glory Be. He actually stands up from his chair, and I know, okay, this is the beginning of the appointment. The beautiful thing is that when I see him, it's sometimes the first or the second appointment of the morning. So it's a great start of the day. So that is a big highlight.
That's beautiful. I'm curious if you've had something happen that I've had happen with patients where instead of calling you Dr. Rodriguez, they accidentally call you Father Rodriguez.
They do. This particular patient has. It doesn't happen much often anymore with him, but he has called me Father Felix.
So, Felix, it's often difficult if a friend, a family member, a coworker is newly diagnosed with cancer, we don't know how to talk to them. We don't have the words. What advice can you give us viewers on how to interact with that friend, that family member, or that colleague who's newly diagnosed with cancer?
So I would say, this is to quote Pope Francis. Pope Francis has this very beautiful phrase called the theology or spirituality of accompaniment. And so when a family member or a friend is suffering from cancer, they don't necessarily want you as a family member or friend to give them answers, but they want you to be with them. Even if it's just providing a listening ear, or for instance, if they need help with grocery shopping. There are these things that they're unable to do, or unable to, or not want to do because they're tired, they're fatigued. And so if you're there for them and you know that you're present and they know that you're present for them, that is something that they will always be thankful for.
That's a beautiful piece of advice. And speaking of advice, you know, how can we parents teach our children how to understand and talk about cancer, especially if the child's parent or grandparent has cancer?
Well, so it depends on the age group of the child. We have to understand that children won't necessarily express their feelings when they see a friend or a family member go through cancer. So we have to try to see why they may be misbehaving or why they may be not wanting to interact as they used to before. And try to get age appropriate conversations with them, try to understand their fears. Interestingly, I want to bring up a novel that I read about 5 years ago. It's called A Monster Calls. And it was a novel based on a child that was going through the stage 4 cancer of his mother. And so he was, the way that he dealt with it was by imagining that the cancer was this monster. Actually, the funny thing, it was the tree that he imagined. It was a gigantic tree, and it was the evergreen that is used to make some chemotherapy. So
Oh,
that was a novel to that I like, because I said, okay, so this is the way not only children but adults they frame their process in a different way, and this is very difficult. Rather, I cancer patients don't get enough of the emotional support that they need, but it's helpful for parents to be open to, as I said, try to listen out to them and how they may be envisioning the cancer process of their family member or friend.
that's beautiful. I wonder if parents are going to go out and buy that book now. It sounds intriguing to me. Felix, what do you wish that every cancer patient knew that they often don't know?
I would say that they need to learn to trust the team that is taking care of them. Uh, well, and I use the word team because even though I am the quote unquote team leader as the medical oncologist, uh, I rely on my nurses, I rely on my staff, and I think it's important they realize if they have gone to an office where they feel that they are being understood, that they learn to trust them and to be open to them. I always, and the other thing I always tell my patients, they should know that they can ask us anything. I tell them there are no stupid questions here. You may think that your question is simple and stupid, but no, it isn't. Bring it up because it may make a difference in the way that you understand your cancer or the side effects that you may have. So it is, to keep using that word, a process, but I want to make sure that they understand also that they need to communicate better with us.
And Felix, I just asked you about what every cancer patient should know. What do you wish people without cancer who think, oh, it's not going to happen to me, what do you wish they knew that they don't know?
So for starters, there are these cancers that have a lot to do with diet or lifestyle. So it's important they are constantly getting themselves educated about those risk factors. And I know that we will be talking about that on another show. But the other thing is to make sure that for the cancers for which we have screening guidelines, that they are constantly going to their primary care physician to on the regular intervals that are needed to go through those screenings so that we can detect their cancers in an early way.
I've noticed that with cancer, patients tend to seek alternative treatments more than with maybe other diagnoses. What do you think is behind that, Felix?
Well, they want to be in control, as we said at the beginning. And there are conversations that they may have with family members, with friends. They go onto the internet and they start looking at information. And so I'm not completely opposed to them reading that information, but something that I always tell them is if you're going to seek any type of alternative medicine, make sure that you tell me, because if I am going to be giving you chemotherapy or any other treatment for your cancer, there may be serious interactions that you are not prepared for. So as long as they maintain that trust to continue to repeat the same message, then I encourage them to bring on all those questions so that if I feel it's safe that they can use anything alternative, I can educate them on that.
Felix, thank you. You've taken time out to explain some basic, helpful things to patients who are facing the mystery of cancer. Thanks for being with us today.
Well, thank you again for having me.
I think the main take-home point for me that I heard from Felix is that there is hope. Things are always getting better with diagnosis, treatment, side effects, and how long we live. So if you want to learn more about cancer, there's plenty of places on the internet to do it. And watch the other show that we're doing with Felix. And thanks for watching this episode of Vital Signs, your prescription for a healthy family, brought to you by Shalom World TV and the Catholic Medical Association, where we are inspiring physicians to imitate Jesus Christ. Please join us for our next episode and share the good news of vital signs with a friend, and may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
All of the viewers of Shalom TV throughout the world, I want to encourage you not only to support this amazing media apostolate, but to spread the word to others. We all know how the internet and mass media are polluting the world with the poison of pornography and so much other forms of materialism. This is the source of eternal life, the gospel, and Shalom TV is consecrated to spreading the word of Christ. Thank you.